Hello and welcome back to A Functional Approach with Dr. Jim Chaltis. I recently recorded a podcast on chronic pain, which led me to this topic of fibromyalgia. Fibromyalgia really encompasses, the energy of chronic pain. It's a systemic, painful condition that can look like a lot of different things for a lot of people, but it has some common threads. So today I want to talk about what is fibromyalgia? How does it look? How does it feel? How is it diagnosed? Right? What does maybe a mainstream doctor do to approach this condition? And how does somebody in the functional medicine arena handle this kind of a situation? If you don't already know about your fibromyalgia case, and maybe you're thinking that you have one, right? What you might be experiencing is chronic pain all over your body. It can be, in all quadrants of the body. It primarily focuses in the torso, in the neck, and kind of like the arms, more of that trunk presentation, but it can really be in all areas of the body. And commonly it is. It's systemic pain, right? So that's why I like it for this chronic pain concept, because it really covers so much of the body. So that pain, it can be dull and achy. It can be kind of throbbing. It can burn. It can be tingling. It can be stabbing pain. It's kind of different for everybody. But it has to be in multiple regions all over the body. And it generally has to present as chronic, like something that you deal with every day. Almost all your waking hours, you're noticing it, right? It can come in some cases, come in bouts, where you're feeling okay for a little bit, day or two, and then seemingly for no reason, whammo, now you're dealing with this really intense pain scenario. So that, in a nutshell, is kind of fibromyalgia pain. How it's diagnosed can be a little bit different for everybody, right? It's one of those conditions that doesn't have a very clear criteria. You'll go to a doctor, you'll explain your pain, they'll check you in certain areas. If you qualify for enough painful spots around the body, that might be enough right there to diagnose it. But usually they have to kind of, test you for pain severity. There's written questionnaires, so they're going to look for pain severity. If you're in that moderate to severe pain all over the body, again, that's probably something that they will diagnose. But oftentimes it's a diagnosis of exclusion, right? You checked everything else. You're having pain all over your body. It's significant pain. It's chronic pain, fibromyalgia. Now, it might also come with things like chronic fatigue. So this kind of pain and fatigue concept really do come hand in hand in a lot of cases. And I'll explain why in a moment. So when it comes to causes, what causes my fibromyalgia? Well, science isn't quite sure. I'll be honest with you about that. It's debatable. They haven't really been able to nail down any specific one mechanism that causes this set of symptoms. And I think that's an important concept to understand too. You're presenting yourself in this condition, the doctor's checking you, and they're really diagnosing on a set of symptoms. Right? It's different than saying, I have a flu bug in my body, therefore we know the mechanism is a virus, right? That's not how it works with fibromyalgia so much. It's kind of this set of symptoms. So we don't know exactly what the mechanism is. It could be different for everybody, which is really the beauty of a functional approach. We're going to try to get in there and find those mechanisms. So what it's not considered to be right now is autoimmune. That's perhaps a common misconception or a common question. And I'm not saying it isn't, but science hasn't proven that it is yet. What science is really saying at the moment is there's, potential genetic links combined with environmental pressures. Put those two things together and then whammo, you have your inflammatory condition that somebody will call fibromyalgia. From a functional medicine perspective, now, we tend to think of fibromyalgia as either one or a kind of combination of the two. High inflammatory pressures that can come from lots of different sources, coupled with low cellular energy, right? ATP. Maybe you've heard of it. ATP is our energy molecule. So if the cell isn't able to produce ATP, it kind of falters in its function. It doesn't even have a chance to rid itself of toxic waste in the cell. So it accumulates. That cell becomes inflamed and sick. Right? That would be one way of looking at it. So we need energy in the cell to keep our tissues healthy and less inflamed and less pain. Right? So a functional medicine approach is going to consider primarily those two concepts. What does a functional medicine doctor think of this type of condition? Like I said before, we're looking for inflammatory sources. They can be many, right? They can be things like food sensitivity reactions. Can't tell you how many times I've found something like a gluten sensitivity. And in a chronic pain case, fibromyalgia or otherwise, they remove that from their diet and their pain levels get so much better because they're just not being inflamed constantly at a neurological level, which is something gluten is known for. So that's one example. But there might be chemicals in your environment, whether you work in a chemical plant or a gasoline refinery, or maybe you just drink a lot of plastic bottles and coffee cup lids. These are toxic burdens that some people just don't have the ability to clear. Those can be inflammatory and drive something like fibromyalgia. So we're looking for those kinds of concepts. Can't forget the basics. If somebody has insulin resistance or diabetes or any kind of blood sugar imbalance, pro-inflammatory, right? So we have to do that. We have to start from the basics. What does the cell need? And then we go from there. We might also, provide anti-inflammatory support or antioxidant support. So kind of the same thing in a lot of ways. I might use antioxidant and anti-inflammatory kind of interchangeably, but things like high-dose fish oils, things like large amounts of turmeric, resveratrol. It's a very powerful antioxidant. We might look for things like glutathione supplementation. Right? These are a list of supplements, if you're following along with my podcasts or my YouTube channel, that I've repeated over and over again. And that's because in functional medicine, we look for the roots of things. We want to find those inflammatory sources, remove them if possible, but also kind of put the water on the fire, right? Add the anti-inflammatory support. Another concept that we might do in a functional medicine model is look for essential fatty acid balance. EFAs for short, essential fatty acids. You've heard of them, omega-3s, omega-6, omega-9s, right? We can do a simple finger prick blood test. Doesn't take a whole blood draw, just a little prick of the finger. You send it off, and we can look at your essential fatty acid status. We want to see some relative balance there. The omega-3s from things like fish oil, from things like flax oil or flaxseed, just to name a few, are anti-inflammatory in general. Things like omega-6, you'll find them in canola oils and a lot of your seed-based oils. Those tend to be pro-inflammatory, and we do need both. The omega-6 pathway does have an anti-inflammatory branch as well. So getting these tests done will break down all of those things, and we can really adjust. Like, what kind of salad dressings are you using? Can we change those, right? Do you need a little bit more, fish oil in your diet? Should we get some flax going in there? So that can be a very big deal when you're talking about inflammation. The fatty acids are also very important for brain function, where a lot of this pain signaling really exists up there in the brain. Yes, I have pain in my torso, but really I have inflammation in my brain. So we want to look at something like an essential fatty acid panel. It's not common in a mainstream doctor experience. It's more of a functional medicine approach. Very powerful. And lastly, we want to support that ability for the cell to make ATP, right? We want the cell to have energy, because without energy, we get fatigued, right? Like I said, they come hand in hand a lot of times. Chronic fatigue and fibromyalgia come hand in hand. So we need to have energy to run the body, run the cells, but also to clear the waste and be less inflamed in general. How do we do that? Supplementally, we can do things like help remove that oxidative stress. So glutathione is the primary antioxidant inside our cells. How much does it take to get that inflammation down and that function up? Right? So glutathione is a very good pick. There's a supplement called NMN. So it can really be one of those things that kind of just helps beef up the functioning of a cell. These are some things I think that are very, very powerful and get to the core of the concept. The supplements are there to kind of help us through, but really we must get the body moving, because what happens when we're in pain and what happens when we're fatigued, right? We sit on the couch, we succumb to that. And the cell must have activity. The supplements might not help if you don't have activity. And second to that, but no less important, is get to sleep. Sleep is a must, because that's when the brain heals. That's when we repair our tissues and we recover from whatever happened during that day. So these are my recommendations in general for kind of the general concept of fibromyalgia. But we have to remember that you are a unique individual. You have a unique condition that somebody called fibromyalgia, right? It's a list of symptoms with an unknown source, and those sources can be very, very diverse. So if this is something that you'd like to explore deeper, then reach out, because we can get that process started and we can start to screen through your blood chemistry, your medical history, medications you might already be taking, your diet, your lifestyle. We can run specialty tests that just don't happen in most medical experiences. We can look for food sensitivities. We can look for chemical reactions. We can look for that essential fatty acid profile, see where you land, right? So these are things that are available, and I would be happy to share them with you if that's something that you resonate with. Thank you so much for your time and attention, and until next time. My name is Dr. Jim Cheltis. This is A Functional Approach. Bye-bye.